I'm Dr. Sita Pati. I just introduced myself to the audience, but I'll share a bit of background. I'm a psychiatrist. I work in Lower Mainland. I'm the Chief Medical Officer for BC Mental Health and Substance Use Services with the Provincial Health Services Authority. So without further ado, let me just give a brief intro here.
Okay.
And Dr. Gabor Maté is a retired physician who, after 20 years of family practice and palliative care experience, worked for over a decade in Vancouver's downtown east side with patients challenged by drug addiction and mental illness. The best-selling author of 4 books published in 25 languages. And Gabor is an internationally renowned speaker, highly sought after for his expertise on addiction, trauma, childhood development, and the relationship of stress and illness. His book on addiction received the Herbert Evans Prize for Literary Nonfiction. For his groundbreaking medical work and writing, he has been awarded the Order of Canada, Canada's highest civilian distinction, and the Civic Merit Award from his hometown, Vancouver. His books include In the Realm of Hungry Ghosts, Close Encounters with Addiction, When the Body Says No, The Cost of Hidden Stress, Scattered Minds, The Origins of Healings and Attention Deficit Disorder with Gordon Neufeld, and Hold On to Your Kids, Why Parents Need to Matter More Than Peers. So let me stop there, and I'm going to turn it around to Dr. Gabor Maté and also the Addiction and Concurrent Disorder Research Group. And I'm going to open it for a discussion here. Let me see if I see any hands up or any questions coming up for me here.
Well, let me just say one thing to begin with. There's nothing surprising about the overdose crisis, especially in tandem with the COVID pandemic. In fact, we might call it a syndemic, 2 pandemics running at the same time. There's nothing surprising about it if you recognize addiction for what it is, which is that it's not a disease that you inherit and it's not a choice that you make, but it's a response to human suffering and trauma. And so that model would predict that when there's more stress on people, there'd be more drug use and therefore more overdoses. And that's exactly what happened. Not just in terms of overdoses, but there's all kinds of evidence that people are drinking more. There's more domestic violence. More babies are having head injuries because of domestic violence. More women are depressed and anxious. In other words, if we recognize that the human brain and its functioning and the human psyche are connected and both inextricably interwoven with our environment, particularly our social, emotional environment, then what's happening now is exactly what you predict to happen. And just last week, there was a study that came in. I don't know how many of you are familiar with the work of Stephen Porges, the polyvagal theory. It's essential work to anybody working in therapy and healing. And without going into the details of his work, but he's world renowned and appropriately so, his study last week showed that the people that are more affected by the COVID crisis are precisely the ones who had suffered more childhood and earlier adversity, which again would go along with the model that I just outlined. So COVID isn't hitting people equally or randomly. The crisis of COVID is hardest on people already traumatized. And that, of course, is what's happening in the addiction world as well. So those would be my introductory remarks.
Thank you, Dr. Mate. So I'm going to kind of remind the audience that if you guys could type in the questions on the questions box, and we'll be having about 9 minutes of some discussion with the Addiction and Concurrent Disorder Research Group here, and then we'll turn out to the audience, and I will be able to kind of moderate those questions to Dr. Gabor Maté. So before we start, you know what, I just want to kind of it's a comment or a question, we could call it. I just want to share something from my end and then maybe your perspective on it. So looking at the history of the overdoses and the pandemic, you know, what has been engulfing over the past 6 years now in Vancouver. Looking back 20 years ago, I mean, we've seen the HIV and we've seen the pandemic, and we had a series of overdose deaths there. and there was an outcry for looking at how the treatment and availability of methadone and et cetera, and how we kind of pull the strings down, including treating the HIV, treating the addiction appropriately, giving access and giving substitution treatments at the point. Now we're 20 years down the line, and we are looking at 4, 5, 6, 7 times higher than the rates what we see in 20 years ago. There are different systemic factors, but if you don't mind, just to share your perspective, what do you think could be some key areas we may need to address
Well,
in looking at that?
sure. So thanks for the question. If we look at the problem purely in health terms, we're never going to find the answer because the crisis of addiction is not a health issue. I mean, it shows up as a health issue, but it's a social issue. In other words, there's broad social factors that are driving people into addictions. And those broad social factors have to do with, number one, trauma. And I have to say, in my experience, and as far as I can tell, I'm not practicing as a physician anymore, but most physicians still leave medical school without any awareness of the impact of trauma on human life. Whether it shows up in the form of mental illness, physical illness, or addiction. So that we don't have a system that's designed to actually deal with the full dimensions of the problem. That's within the healthcare system. Now, beyond that, people become addicted because of, let's look at the First Nations experience. Is there some reason, or is there not a reason, why First Nations people make up 5% of the Canadian population, but 30% of the population of the downtown east side and 30% of the jail population? Yeah, the reason is historical trauma, as we found out again in the dreadful discovery of these young children as young as 3 years old in Kamloops no more than a month ago. And Canada has not addressed those social issues. Our First Nations people are still excluded, oppressed, and traumatized.
Yeah, you know
Uh,
what? Thank you for that. I'm
no,
with you
no,
on
no, hold
that.
on.
It is much.
I just want to complete what I'm saying.
Yeah, please go ahead.
So, furthermore, the educational system is not informed about the basis of childhood behavior. So a lot of these kids that later become addicted are punished and ostracized in the educational system. And finally, I'm going to quickly say that COVID brought this vast public attention, governmental mobilization, scientific ingenuity into dealing with the crisis. And lo and behold, we have vaccines now and we're dealing with it. Well, if we could bring science to bear on COVID, why don't we bring science to bear on addictions and public policy? So then you ask the question why? It's because the medical professionals are not trained to understand it. Public policy goes contrary to what people need, and we live in a very traumatizing society. So that's why. And so the medical professionals and the nurses and the health professionals, it's like we're using this small cup to try and empty the ocean.
No, thanks for that. So I'm with you on that, and I think addiction is a much broader issue than just talking about just one intervention in one area or focusing one area. There, either it's medicine or substitution or social, I would say. But just to kind of redefine that a little bit more, what do you see would be the role of addiction medicine? Another question what's coming up is what do you see the role of addiction medicine if you are considering that it is more socially focused when we're talking about addiction, and then if you don't believe addiction is a mental illness, and what would be the role of the treatment and medication, and how do you see that we could complement that with what you're saying?
It's not that I totally reject the medical model. I just think it's inadequate. In other words, addiction shows up like a disease in many ways, relapse and physiological effects and so on. So that's a helpful way to look at it. And it's certainly more humane than thinking that it's a moral failure. It's just not adequate. And so what addiction medicine needs to broaden its perspective, needs to understand that every person you see in your office is the result of multi-generational family trauma. And the addictions in every single case, and I don't care if you're addicted to pornography, sex, gambling, shopping, or drugs or alcohol, in every case, the addiction is an attempt to escape human pain, suffering, loneliness, disconnection. Unless we deal with the underlying pain, if focus only on the behavior, we're dealing with symptomatology, not etiology. And so what I'm saying is that there's a useful role for addiction medicine. There's a lot of great people working in addiction medicine, but they need to broaden their perspective. And so that when they see clients, it's not just about dealing with the addiction issue as such, it's also about dealing with the whole traumatic impact that drove people into addiction in the first place. So addiction medicine needs to continue. And of course, what we can do in terms of medications and substitute medications and so on, that's essential work for a lot of people, particularly when it comes to substance addictions. We just need to broaden our perspective. And I'll say finally that we keep talking about evidence-based practice, but if there was one phrase that I could extirpate from the medical lexicon, it would be evidence-based practice, because I only wish, because there's so much evidence for the relationship of trauma and addiction. Where does it show up in medical training? Nowhere. I only wish that we based our practice on the evidence.
Yeah, no, very well said. I think from what I'm hearing is, we're not kind of discounting or dismissing all the other complementary stuff, what we can definitely do in terms of treating. But what I'm hearing is like you need to understand the root cause. And if you don't hit the root cause, and you're really going to be looking at maybe tip of the iceberg or just the surface, and which is not sufficient. Very well said, I would say. And I think I've got a couple of questions which is coming in the chat box here. I'm just going to kind of try to put it together. It's talking about, okay, there's a lot of discussion, like, and from what you're saying, Dr. Maté, about the definition of trauma, the disconnection, and what happens in one's own self, the past history, and the previous experience. And what I'm hearing is that is really important. But why is that people are not discussing? And why is that we are not talking about it? And why are we not addressing it sufficiently, would you say?
Well, that's a complex question. So first of all, let me just quickly define trauma as I understand it, so that at least for this conversation, we speak the same language. So trauma is not what happens to you. It's not the terrible things that happen. Trauma is specifically the Greek origin of the word trauma is wound. So trauma is a wound. So trauma is not what happens to you. It's what happens inside you as a result of what happens to you. And trauma has many impacts on the development of the brain, on the development of the personality, and so on, and the coping mechanisms that they then employ to deal with the pain of the trauma. And addiction is one of them. Now,
Got it.
now, why we don't address it? Well, there's lots of reasons for that. First of all, Western ideology is still rooted in this mind-body separation, not just when it comes to addictions, when it comes to illness in general. We just don't understand the unity of emotions, physiology, the immune system, the nervous system, the hormonal apparatus. Uh, there's a whole science of psychoneuroimmunology that has more than elegantly delineated the pathways which, with emotions and social experience, is connected to our physiology. Let me give you an example. The more experiences a Black woman in the US experience of racism that she has to endure, the greater her risk for asthma. Now, what does that tell us? And by the way, how do we treat asthma? With stress hormones, adrenaline and cortisol. So that should tell us that there's a huge, there's an inextricable unity of mind and body. But Western medical education ignores that altogether. I mean, the average medical student does not get a single lecture on trauma, does not get a single lecture on the mind-body unity, despite the documented, when I say documented, I'm talking tens of thousands of papers published in scientific and medical journals. So it's missing in our education, number one. Number two, let me tell you about a little thing called telomeres. Do you guys know what telomeres are? Telomeres are T-L-E-M-O-R-E-S, Nobel Prize winning scientific work. Telomeres are DNA structures at the end of our chromosomes that keep the strands of chromosomes from unraveling, like the glue at the end of a shoelace. They looked now telomeres. We're born with about 10,000 units. By the time we die, we have 4,000 units. So aging shortens telomeres, so does stress. So you can measure the telomeres of people, and they will tell you the not the chronological age, but the biological age. And if you look at the telomeres of black women in the US, they're shorter than white women of chronologically the same age. Now, they looked at the telomeres of medical students. Do you know something? They shorten much more in a year than those of other university students. That has to do with the nature of medical education. It's stressful and traumatic and traumatizing. And that means that people come out of it stressed, driven, and no tools to understand either their own trauma or those of anybody else. And one more thing,
Yeah.
if a trauma informed perspective, I mean, I once was invited to speak to the Senate in Ottawa, or Senate committee on more punitive drug laws, and I gave them all the evidence and all the science, and I could see that it's not that it went in one ear and came out the other, it never even went in one ear. And I finally said to them, senators, as a physician, you asked me to practice evidence-based medicine. How about you practice evidence-based politics? Because if there was evidence-based politics, we wouldn't be treating people the way we're treating them, and we would open up people to many more possibilities of rehabilitation and redemption. So it's not just the doctors and it's not just our own particular narrowness. It's also that we work in a system that constantly stresses people and makes things worse for them. And then we're asked to fix them. It's a tough goal.
Yeah. Yeah. I hear that. No, thanks for that. Another thing, there's quite a few questions coming up, and I'm just going to kind of try to pick on some of those areas where people are talking about. One of the questions what's coming up is, do you have specific advice when working with young people and youth in addiction when addressing attachment
Yeah. So,
or attachment issues? What I'm hearing. Yeah.
so I mentioned Stephen Porges' work on polyvagal theory. So he talks about how the state of our autonomic nervous system defines our worldview at any given moment. So that I know that when I'm in a state of hypervigilance, sort of sympathetic nervous system activation, my view of the world is very different than when I'm at parasympathetic rest state. Now, what creates that parasympathetic rest state where I can actually calmly attend to what you're telling me and interact with you in a attuned fashion is I have to be in a certain parasympathetic state. What creates that state is safety. Now, Poirier says the safety is not just a matter of the absence of a threat, but it's also the presence of connection. So the biggest thing that no, these youth, now we think that addiction prevention has to do with telling kids how bad drugs are. Nothing to do with prevention, because the kids who are listening don't need the information, and the kids who need the information are not listening to adults because they've been hurt by adults. So what needs to happen is a relationship with those kids where they feel safe, where they open up and they can learn and trust. So the most important thing in working with youth, well, with anybody actually, but particularly with youth, is creation of safety. And that safety has to do with, can we connect with them? Can we understand them? Can we see their experience and validate it? Then they can relax enough to listen to us. So it's connection.
Got it. Just to kind of follow up on that question, like, for many of the audience here, they are frontline clinicians, they see clients and the patients and the loved ones going through this problem. But what would you say is a take home tips for most effective ways to addressing the trauma which is embedded within those addiction or substance use problems for patients, what we see, or clients, what we see, or the loved ones, what we see? Um, any tips or any suggestions for them?
Well, many. I can just say a couple in very briefly. One is that there are many modalities to dealing with trauma. I have an approach I teach called compassionate inquiry. There's somatic experiencing, there's EMDR, there's body other body-based therapies, emotional freedom technique. I mean, there's a whole lot. There's of course what's it called? Dr. Miller's work, interviewing. What kind of interviewing? You know what I'm talking about, don't you? His name is Miller, and it's some kind of interviewing. I'm trying to remember the name. It's not come to me at the moment. Motivational interviewing. Thank you. That's the word I was looking for.
Yeah.
There's
Yep.
lots of modalities, but the most important thing is not the modality that you employ. It's that you be trauma informed. The trauma informed doesn't mean that you have to be trained in trauma therapy. Trauma informed means that you be informed by trauma, which is that when you're looking at a person, you know two things. One is they're not their behaviors, that their addiction is a response to pain. So you know that. So you're trauma informed. You see that that's who they are. And you're not blaming them for their behavior. You're not blaming them for their relapse. Number one. Number two, you know that they're not their behaviors, that the essence of trauma is disconnection from the self. Recovery, which means to find something again, means recovering yourself. And that self is in there. And if you can see that true, authentic human self in the person that you're looking at, then they can see themselves in a new way, maybe. And so trauma informed doesn't mean you have to be trained in trauma therapy. It means you have to recognize the trauma and recognize the true individual that is in there with healing capacity, whose healing capacity can be evoked and encouraged by your compassionate presence. And that's the most important thing, is your compassionate presence.
Yeah, I know. Thank you so much. I know there's plenty of questions coming through, and I'm just going to just wrap around with wrap up with just one last question. In your opinion, what would you say are the immediate steps forward to change the public stigma associated with addiction and mental health? And we definitely have our own problem as society in order to repair it. But what would your opinion as immediate steps to address this?
Well, as soon as Justin Trudeau phones me up and asks me for advice, I'll give it to him. But so far, he hasn't phoned me. Neither does Stephen Harper hasn't phoned me. Mind you, the Hunter Biden, the son of the current president, actually talked about my work on Canadian radio once because he's traumatized and he's read the book, my book on addiction. But my short answer is I don't know how to answer that question. I mean, I have a fairly broad platform, thank God. It's worked out that way. So when I speak publicly at any opportunity, like I did this week on CBC Radio, I talk about this. There's my books. There's all the work that I do. There's the work that Bessel van der Kolk does and his work. The Body Keeps the Score. His book is a bestseller now, has been for a while. Bruce Perry, another wonderful psychiatrist who used to work in Canada as well. He just published a book with Oprah called "It Didn't What Happened to You" about trauma. So all we can do at any level and whatever platform you have and whatever level you're working at is to advocate, to speak out publicly, um, to challenge the politicians when you have a chance as to why they don't practice evidence-based politics. Um, but I don't have a magic answer, and all I can, all any of us can do is to speak as articulately and as loudly and as calmly as we can. And beyond that, it's going to be the way it's going to be.
You know what? Well, thank you so much. And I really want to kind of segue and take the take-home message of this evidence-based politics. You know what? I love that. So I love the phrase, and I can see a lot of questions and a lot of appreciation coming on the chat box too. And thank you so much, Dr. Maté, for joining us and sharing your insights on this important piece of work like we need to do together to kind of move things forward. Thanks a lot.
Thank
And
you.
I'm going to just remind the audience, yeah, remind the audience to kind of go into the next set of workshops on lightning talks, which is going to start at 12 noon.
May I say one
Thank
last
you so
thing?
much.
May I say
Yeah,
one final
please.
thing? So some of you may have seen this, but 2 weeks ago, a documentary about my work was launched online. It's called "The Wisdom of Trauma." Now, it's been seen by 4 million people in 240 countries or 220 countries. It's still available to be seen for one more day. It's on for today. It's called The Wisdom of Trauma, and I talk about addiction. It'll be on again, but it'll disappear after today for a while. If those of you interested, you could check out the film The Wisdom of Trauma. And with that, thank you for listening to me and for inviting me, and I really appreciate the work you're doing. Thank you.
Thanks a lot.